It's great when healthy eating and exercise habits start early in life. Families play a big role in helping kids to avoid weight problems and some of the health issues associated with childhood obesity. Joining us now is SMDC pediatrician Dr. Nancy Beery. Thank you for being here today.
Thank you for inviting me.
You know, just to start talking about this topic, how big of a problem is childhood obesity these days?
Well, as most newspapers and newscasts, as we hear in the media, it's about 1/3 of our children are struggling with childhood obesity. It's becoming an epidemic, and now we need to start doing something about it.
Well, I understand there are some state and national initiatives to help us be more aware about this issue.
Right, and I'm excited to announce, and I'm not the person behind this, but the Child Nutrition Act is going through Congress at this point, and hopefully our legislators will find that it's important to feed our children nutritious meals at school.
Well, certainly, and there's things going on statewide as well, I understand, that you're involved with.
Yeah, statewide, in our local community, we have an initiative looking at what are the meals being served in our local schools and how can we make some changes to implement some of the initiatives requested or recommended by the Child Nutrition Act. So that's what we're actively doing in our community.
Well, what should a parent do if they think that their child may have weight problems?
Well, I think it's kind of a more like a three-prong approach. One, I think parents need to be the role model. And if they're eating healthy and they're providing healthy meals and eating fruits and vegetables at home, they are providing the right parental support. Number two, I think that it's important that children play and have activities that they enjoy doing, that it's fun. In the adult world, we call it exercise. Children just need to play hard. And three, I think the other component, what is our school environment like? If we're providing healthy meals at school, providing opportunity for play and physical activity, I think we're doing the right thing.
That's all good stuff. And of course, a lot of the foods that are marketed to kids aren't always the healthiest. And certainly when it comes to sugar content, that can be a big problem. And we have some examples here where once you really see how much sugar is in some of these items, it can be eye-opening. Let's start with the Pop-Tarts. What family hasn't had Pop-Tarts?
Yeah. And Pop-Tarts, I mean, some people believe that, hey, it's a quick carbohydrate that we can grab, have a glass of milk, but each Pop-Tart, and this is the 25% reduced sugar, has 3 sugar cubes per serving, and most often you would probably eat 2 Pop-Tarts, so you're eating 6 teaspoons of sugar or 6 sugar cubes.
And, well, of course, when we think about sugary pop, and some parents think, well, if it's orange, maybe it's a little healthier, but certainly the sugar content is high.
Right. There are 50 grams of sugar in 1 can of orange pop.
And that's the equivalent of 12 sugar cubes.
12 sugar cubes.
Wow. And then, of course, it's summertime. People like to have their ice cream. But we have a medium blizzard here, and wow.
22 cubes of sugar. So that's quite a few. It would probably be meant to shared by at least 4 people.
Yes, if you're willing to share. But obviously, that would be the healthier thing to do. And of course, as Dr. Beery said, parents need to be good role models when it comes to eating fruits and vegetables. Now, dietitian Lisa Spooner has some tips for encouraging veggies and healthy snacks.
Chop up the vegetables, put them in the fridge in a shelf that's easy to see so they can grab. When you bring the fruit home, instead of putting it in the fridge unprepared, cut up that watermelon, cut up that cantaloupe, so it is in a container that they can eat it. We have to remember kids will like fruits and vegetables if we offer them. They want to be healthy eaters. And we want to give them the idea that snacking is healthy. And so as parents, we want to come up with ideas to help them when they're on their own making snacks. What can they pick? So some of my favorites, preparing those fruits and vegetables ahead of time. So veggies and dip, or veggies and hummus, something like that would be an excellent snack for kids. An apple and a handful of nuts is definitely a nice, well-balanced snack. Healthy granola bars and a piece of fruit or a piece of string cheese would be an excellent snack. Our old reliable graham crackers and puddings would be an excellent snack. I think what we need to do is help kids be organized when they're snacking, get them to the table, get into a place where they're doing their snacking, so they understand that fuel is going to get them to the next meal.
Some good advice there. And why is it important to get kids in the habit of eating healthy when they're young?
One, I think it sets a baseline for them to provide good nutrition for their own body, and two, with the epidemic of obesity, to prevent extra weight gain on their body. So that's important to establish good nutrition habits early.
Let's talk a little, if we could, about the pediatric weight management program at SMDC. What's involved in that program? Who does it help?
Well, in our program, we are open to ages 6 through 18. And what it takes is a referral from your physician to the program at SMDC.
Excellent. And then once you're there, you get help, I'm sure, with being more active and learning how to eat well as a family. It sounds like it's really for the whole family and not just the child.
Right. We use a behavior model incorporating the whole family to see a dietitian, physician, exercise therapist, behavior therapist, and we use a team approach to help troubleshoot and come up with some goal settings for the family.
Well, before we wrap up, any final thoughts for families on making changes like these with our busy lives?
Well, I like what Lisa says. Be prepared, plan ahead, and make it simple, make it fun.
Great advice. Thank you so much, Dr. Beery.
Thank you.
And thank you for joining us for another edition of Healthy Living, brought to you by SMDC. If you miss an episode, you can catch them online at SMDC's website or go to SMDC's YouTube channel. We will be back the last Monday in July to discuss stroke prevention and treatment, plus life after a stroke. Have a great night and take care.
Healthy Living is brought to you by SMDC.